If you're worried that you might have contracted COVID-19, you might want to step on the brakes before running to the hospital to be screened and tested. The Ministry of Health is urging people to call the *719# hotline number to report any and all probable cases of COVID-19. On the call, you will be connected with a doctor from the Ministry of Health who will give you a virtual consultation to assess for signs of the coronavirus.
We have 50 doctors. They assist the public or even the healthcare workers outside there. In suspected case, in a probable case, they will go through in terms of like a history of travel, or have you come into contact with a person who have already been diagnosed positive. After that, now they'll ask the questions in terms of like, are you coughing? Do you have fever? Are you having difficulty in breathing? Is the cough dry or not? Are you having fatigue?
All of the calls are plugged into a safe and secure database which generates reports and helps the Ministry of Health and other agencies track and monitor the outbreak.
If you say that someone is coughing or it's having shortness of breath or it's having fever, doesn't mean it's purely COVID. So the doctors are able to differentiate that. But when that one comes, when they see a case that is mixed probable or suspected, then they escalate it to the EOC team and the rapid response team. Either they send an ambulance to go and pick the client, and then they are able now to test, and then if it's positive, or even to isolate.
In a larger effort to mitigate the spread of COVID-19 and to ease the burden on healthcare facilities, doctors are swapping face-to-face consultations and checkups for virtual ones, paving the way for telemedicine to finally achieve some of its long-promised benefits. At the Aga Khan University Hospital in Nairobi, many specialized physicians are utilizing telemedicine to connect with their patients by way of video and telephone consultations. It is also being used for teleradiology and for remote patient monitoring.
The nurse does the triage part, but in this case, the nurse is doing it on the phone. The patient can have their blood pressure and their heart rate and even their oxygen levels checked in their local pharmacy if necessary. And nowadays, patients have those digital devices that allow them to check their blood pressures at home. And most of the information is provided through those devices. Loaded with that information, the patient will then consult the nurse, and then that information can then be shared with the doctor. If there are no physical signs for the patient to report and it's a patient that I know quite well, then usually what I'll do is I'll just have the consultation, have a conversation with the patient. A telephone conversation is perfectly sufficient.
Telemedicine is just the tip of the iceberg when it comes to utilizing technology in the healthcare sector as it continues to bring services to people rather than people to services.
So telemedicine is not being given as an end option. It is being given as a first option. If indeed you are not satisfied about your assessment of the patient and evaluation, then you can decide, should they continue the medication or indeed do they require admission.
With many changes rapidly taking place in the delivery of healthcare in the midst of the COVID-19 pandemic, one thing remains certain: the potential for telemedicine to grow and impact positively on patients and healthcare providers is bright.
This kind of consultation, I think, has changed a little bit the approach of clinicians. We've approached it previously with a little bit of uncertainty and suspicion and about its effectiveness, but there are good data that suggests that the quality of the consultation and the ability to arrive at a diagnosis are not very compromised by doing a telemedicine consultation, so long as you follow a particular structure. And the structure we followed essentially is designed to mirror the face-to-face consultation we sometimes have, that we tend to have with our patients.